Welcome to our educational video series for joint replacements. If you're watching this, that means that you've decided to move forward with having either a hip replacement or a knee replacement for me. And before we get going, the first thing I would like to say is thank you. If you are trusting me with your surgery and trusting me to help you get back on your feet and improve your activity levels, that really means a lot to me. I know that there's a lot of other surgeons who would be able to do this, and the fact that you've chosen to have me do it means a lot to me. It's a responsibility I take very seriously. And that's why I've made these videos. I want to make sure that I've assembled all of the information that I think is most relevant for this surgery so that we can educate you and give you all of the tools you need to have a successful outcome and make a good recovery from this surgery. So I'll be going through a lot of information here that I think is important and will help you to get off on the right foot as you prepare for surgery, go through surgery, and then recover from surgery. Now, the most important question, I think, for a hip replacement is, at the end of the process, after you've recovered and gotten back to your normal routine, will you be glad that you went through it? And the best data on this actually comes out of Australia, where they ask every person in the country who's had a hip replacement, are you satisfied or not? And you can see here in the statistic from that registry, if you add up very satisfied and satisfied, it's about 90% of patients. So that means there's a 9 in 10 chance that if you have a hip replacement, you'll be glad you did. Now, I think the reason that people find satisfaction with this is if they can get back to doing things they weren't doing beforehand. It's a recovery process that's challenging and strenuous and involves a lot of things on your part, going through the physical therapy and working to make the recovery. And so you want to make sure that you're doing it for the right reasons, that there's something you can't do because of your hip pain, and that if you could get that thing back, it would make it worth the recovery process. And that's incredibly personal. It can be different for different people. It can be things like hiking or biking or gardening or getting onto or off of a boat. All of these things that we enjoy doing here in the Great Northwest. But that's incredibly specific to you. And I think that that also gives us something to work towards as we're pushing through the recovery process, so that you know why you did this in the first place. And then once you hit that milestone, it gives us something that we can celebrate together. And that's one of my favorite parts of what I do, is when people come back to my clinic and they've gotten back to those things, and then we can celebrate them together. Obviously, a joint replacement is a big surgery, and one of the things that you want to make sure you're aware of as you're preparing for it is what the risks are. And a lot of times when people think about risks from a major surgery, what they're thinking about are things like a heart attack or a stroke or a blood clot that goes to your lungs, which is known as a pulmonary embolism. And you can see here that the risk of all of these things is very low, but they do happen, right? And that is something that we'll touch on later on in this series. We want to make sure that you are in the best medical condition possible to minimize the risk of all of those sorts of things. And if there's any benefit to delaying surgery so that we can further optimize you from a medical perspective, to make sure that we're minimizing the risk of something catastrophic like that as much as possible, we'll work with your primary care doctor to do that, to make sure that we're giving you the safest surgery possible. But here you can see for this type of surgery what the actual risks are. Obviously, these depend a lot, though, on underlying medical conditions. And again, that underscores the importance of working through an optimization process to get you in the best condition possible before we do your surgery. Now, there are also risks inherent to the surgery itself. And when we talk about total hips, there are several things that I want to touch on to talk about what can go wrong with a total hip and the steps that I take to try to prevent that from happening. The number one reason that total hips fail is infection. And the number one risk for an infection of your total hip is if you're not in the best medical condition possible leading into the surgery. And if it feels like I'm beating a dead horse here, it's because this is so important. This is why we have to use every resource possible to make sure that you're in the best condition possible before your surgery, so that we make sure you're in the optimal medical condition to minimize the risk, not just of those medical complications, but also the surgical ones, especially infection. One thing that you'll notice here is very low is the risk of wear. And this is something that a lot of people will ask me when they see me in clinic before surgery is, how long can I expect my total hip to last? We used to have about a 20-year shelf life on total hips, but with innovations that have happened in the past couple decades, we now aren't seeing them wear out the way that they used to. And so as long as we can get you through the surgery process without having any complications, my goal for every hip that I put in is that it would last for the rest of your life. Obviously, we know that some people will eventually return and have additional surgery on their hip, but I go into every case hoping that the hip I put in is the one that you're going to live with for the rest of your life. A few other complications that are important to talk about here are dislocation and fracture. So dislocation is the hip actually popping out of the socket. And when I do total hips, I do them through the anterior approach rather than some of the other approaches through which you can do a total hip. The reason why I use that approach is that it minimizes the risk of the hip dislocating. In most studies on anterior approaches, it's less than 1%. One other risk that we have after a total hip is the bone breaking around the total hip. This is particularly high risk if you have osteoporosis or soft bones. And if that's your situation, it's a conversation that I like to have with my patients in the lead up to surgery, trying to decide how best we can minimize your risk of having a fracture afterwards. One option that we have is using bone cement to fill up the inside of the bone rather than relying on the bone to grow into the metal, which is what I do with patients who have stronger bone. And so that's a little bit of a personalized decision that we can make depending on your medical condition and the severity of your osteoporosis as we're planning out your surgery. As we prepare for surgery, as I referenced previously, the number one thing that you can do to set yourself up for success is make sure that you're in the best medical condition possible. And this is a team approach that will involve myself, the rest of my team here at Island Orthopedics, and your primary care doctor. And this is very tailored to whatever your medical conditions are that you have in addition to your hip or knee arthritis. As a component of this, we'll get labs on you, we'll get an EKG, and we'll want to hear from your primary care provider if there's anything that they think should influence the way that we work through the surgery process with you. Additionally, if there are any specialists that you see, we may want to hear more information from them so that we can tailor a plan that meets your specific medical conditions. We'll also want to know all of the medications that you take so that we can make sure we tailor our plan for you around those medications and any changes that we might need to make to them. As you prepare for surgery, I also want you to make sure that your body has all of the things that it needs to recover from the surgery. Now, of course, I want you to eat a healthy diet, and you can see here from myplate.gov the general recommendations for what should be on your plate when you're eating dinner. As we prepare for surgery, there's a few other things that I want you to do to make sure that your body has what it needs in order to recover. The biggest thing is I want you to make sure that you're getting a lot of protein in your diet. And we actually check these levels in your blood before surgery to make sure that you do have enough to heal the wound and to form the scar around your joint replacement. But I want everybody to be getting lots of lean meats, and in some situations, people will choose to supplement their diet with some sort of protein or amino acid supplement in the lead up to surgery. And if that's something that you're interested in doing, we can talk to you about what some of those options are. The big thing is, if you're going to supplement protein in the lead up to surgery, I want you to make sure that you're doing it without getting a ton of additional sugar in your diet. We don't want you to be just getting a massive carb load in addition to the protein that you may or may not be supplementing with in the lead up to surgery. Another one that I want you to do is I want you to limit your sodium intake. After surgery, there's a massive increase in the amount of blood flow that goes to the area where you've had your joint replacement as your body is healing. And this brings a lot of fluid into the area. And we want to limit the amount of swelling as much as possible. And one of the things that can help with that is a low sodium diet. So as you're getting ready for surgery, this is not the time to be adding extra salt to your food. Again, something that will help with the swelling, which is going to be one of the big things we focus on in the recovery process. The last nutritional thing that I want to make sure we have in good condition is vitamin D. And we check these levels on you before surgery. If I pick up that those levels are low, I will send you a prescription for prescription strength vitamin D. But generally speaking, here in the fog capital of the world, most of us run on the lower end of vitamin D. So it's not a bad idea, even if you are not deficient in vitamin D, to supplement that as we prepare for your surgery. There are a few medical conditions that if you have them, we will definitely want to get them under control before we move forward with surgery. The three most common are smoking, poor diabetes control, and obesity. As it relates to smoking, if you are a current smoker, we will need you to quit before we move forward with surgery. I'll be happy to help with prescriptions or work with your primary care doctor to get you set up with management strategies that can aid you in quitting smoking, because I recognize that can be incredibly difficult. But it is a necessity, and we can't move forward with an elective surgery until you've quit smoking and we've taken a blood test that confirms that you have. Additionally, diabetes control is a very big risk factor for medical issues or surgical complications after a total joint replacement. And so if your hemoglobin A1C is too elevated, we will want to work with your primary care doctor on adjusting your diabetes medications to ensure that we get that lower so that we can minimize the risk for complications before we move forward with the surgery. The final thing, and this can be a tough conversation to have with patients, can be obesity. There are some situations where I will advise patients that it is in their best interest to lose weight before we move forward with the surgery in order to minimize their risk of complications afterwards. Obviously, these are very delicate conversations, and I want to make sure that you don't feel like you're left hanging and just told to come back when you're skinnier if you fall into that situation. I want to work with your primary care doctor or with weight loss specialists to try and make sure that you have the resources to work through that process so that we can navigate together to the finish line, which would eventually be a joint replacement. One thing that will also try to help optimize before surgery is your mental health, and in particular, we'll focus on depression. It's very common for patients who have arthritis to develop depression because we can get in a little bit of a vicious cycle between the pain from your arthritis, depression, and inactivity. And this they feed off of each other. So when you have pain from arthritis, it's hard to do things. And so that inactivity can in and of itself be depressing. If you really enjoyed hiking and now you're not hiking, you've lost something that was enjoyable, you've lost something that was fulfilling, and that can be tough. Unfortunately, that inactivity also makes your arthritis worse because the way that your cartilage gets nutrition is from exercise. And if you're finding that you can't exercise, it may cause the pain to actually worsen. And then in addition to that, as the pain from this arthritis worsens, that can make your depression worse because you're in more pain. This is now something you're dealing with chronically. And depression can then feed back to the pain and make that worse. So we know that people who are in depression will have more pain from the same physical stimulus. We had talked earlier about the concept of nociception versus pain. And the same nociceptive input in a depressed patient will result in more pain. So you can end up in the cycle you see here where the inactivity, the pain, and the depression feed off of each other and they all make each other worse. And if that's you, we want to make sure that we're treating the depression in addition to your arthritis as we go through this surgery. And we know from studies of patients who have depression, comparisons of those who are being treated actively for depression versus those who are not being treated for their depression show that they do better after the joint replacement if the depression is being treated. So it's obviously beneficial for you to be treated for depression in and of itself. It's a very, very challenging thing to go through, and it can feel like you're in a hole. But from the perspective of your hip or knee replacement, you'll actually do better in terms of your recovery if we're managing the mental aspects of your recovery as well. So this is something that very commonly I'll coordinate with your primary care doctor in the lead up to surgery to make sure that we're managing the mental aspects of your recovery in addition to the physical ones. Obviously, after surgery, we're going to want you to do a lot of exercise. That's where you kind of take things over from us and work with your physical therapist to really drive your recovery forward. The more exercise you can do in the lead up to surgery, the better it will equip you to hit the ground running afterwards. Now, the challenge here is finding that balance between what you can do without causing pain and what will be beneficial for you, right? If you had the ability to do all of the exercise you could ever want, you probably wouldn't be going through a joint replacement in the first place. And I kind of think of this like a ladder. Like the higher you are up on this ladder of exercise, the more beneficial it will be for building muscle and for building cardiovascular endurance, but it's also going to be more likely to hurt. And so the top of the ladder is running. Running is a great exercise, but most people with arthritis find that that's very challenging. As we move down from there, we get to hiking. And many people with arthritis find that they can hike uphill, but not downhill. And so unless you find a place with a slide, it's going to be challenging to do that. Moving down from there is walking. And walking on flat ground is a very good option. And I find that's where a lot of people kind of level out at as they're preparing for surgery. A step down from walking, and this is surprising to a lot of people because it's a more strenuous exercise, is biking. And so because biking doesn't involve the contact of your foot on the ground, it can be less likely to exacerbate your arthritis pain as you're getting ready for surgery. And so some people who've traditionally walked may transition either to a bicycle or to an exercise bike as they're getting ready for surgery. And it can also be a very valuable tool during the recovery process as you're trying to get back on your feet. And then the last thing on this ladder is pool exercises. Pools are great because they eliminate your body weight from the movement on your joints. And so if you are able to get into a pool and move around, you may be able to do movements that are not possible for you when you're just out in our normal environment. And so for some people, as they're getting ready for surgery, they are kind of restricted to just the pool, but it still allows them to keep moving and keep their muscles as strong as they possibly can be as we're getting ready for that recovery process. If you are in a situation where you're only able to do pool exercises, I have here on the screen a few resources for local areas where you can go to get access to those. In particular, the Fidalgo Pool here in Anacortes and the YMCA in Mount Vernon are two places that offer pool exercise classes where you could go to engage in those. And if you know of other places, please tell me because I'm always on the lookout for more. One other thing that you can do to optimize yourself for surgery in the lead up to it is if you are currently taking any opioids for pain control, these would be things like hydrocodone or oxycodone, minimize as much as you possibly can how much you are taking. The reason for this is that you habituate yourself to some degree to the opioids that are in those medications, and it hypersensitizes you to pain. And so we know that you're going to have more pain after surgery because of the insult from the surgery itself. What we do is somewhat painful. And if you're hypersensitized to pain going into that surgery, it can make it harder for us to control your post-operative pain. And so as much as possible, if you can limit or ideally eliminate the use of any opioids prior to surgery, it will set you up much, much, much better to be able to have a less painful recovery after surgery. One of the most common questions I get about total hips is how long it will take you to recover from it. And this is actually a really hard question for me to answer because everybody has their own definition of recovery. But I think this graph here, which comes from a study out of the University of Utah, provides the actual curve so that you can match that to whatever you would define as being recovered. For some people, it may mean just having a wound that's closed up. For other people, it may mean getting back to their high-level activities. But if you look here, you can see that at 1 month, you're about 55% of the way recovered. And in 3 months, you're about 75% of the way recovered. So whatever your definition of a recovery is, you can kind of plot that point along this graph to see how long it would take you to hit that point where you would consider yourself recovered. Now, there are some long-term annoyances that you'll get with a total hip, things that may occur and are unavoidable when we do the surgery. Just because of the fact that we're leaving a lot of things as your own, right? I'm replacing the ball and socket of the hip, but I'm not replacing the muscles. I'm not replacing the nerves, your skin, your joint capsule, or any of these other structures around the hip. And so the two most common things that we find that are annoyances with a total hip are related to the nerves and the muscles. And so from the nerves, there's one nerve that runs kind of across the front of your thigh that supplies the skin on the outside of your hip. And it's right in the area where we work when we're doing an anterior approach. And it very frequently results in a numb patch in the skin on the outside of your hip. The other most common thing that we see is irritation of the muscles. The two most common being the iliopsoas muscle, which is kind of in your groin, and your hip abductors, which are on the side of your hip. If you are experiencing pain on the side of your hip after a hip replacement, and you can dig your thumb into the side of your hip and find a spot where it hurts, it is coming from the muscles over there. And very frequently, people who've made a good recovery from a total hip and are not experiencing much pain will do something that exacerbates one of those muscles, and we'll end up sending them back to physical therapy to try to work on balancing and strengthening or stretching or whatever the physical therapists identify as the issues with those muscles, because when I do a hip replacement, I'm not doing anything to those muscles, and they can still have issues that are separate from the hip replacement itself. So that concludes this first video. I'd like to thank you again for trusting me to do your surgery, and can promise you that as we're working through this process, I'm working hard to make sure that I can do the best job possible for you. Moving forward from here with this educational series, the next video is going to be more focused on the logistics of the day of surgery and your early recovery. My intention is that you would watch that one after the surgery is scheduled and you have a date picked out, and we're starting to formulate concrete plans about moving forward with it. The reason I've broken it up like this is that all of a sudden, right before you have this surgery, you're going to be very focused on one thing and one thing only, which is, hey, this is going to hurt. What are we going to do about that? And that's largely the focus of that next video. It's more on short-term considerations as opposed to the long-term considerations that we talked about in the video today.